How you guys doing? Hello. Good. I'm good. Thanks for taking your time, taking the time out of the day to hear our proposal. We appreciate it. We're here to request your support for our event this year, Reach Out to Youth, which takes place February 1st. And basically, just want to give you a brief intro of what the program is. Just Reach Out to Youth. Our main target for this program are elementary school kids from the DPS system, specifically ages 7 to 11. And our theme this year for our program, which is usually different every year, is heart and lungs. Specifically, we want to focus on those two systems because of the prevalence of obesity, especially in the inner city area. Affecting issues such as diabetes, such as other issues that might affect the heart. And then also we have a focus on the lungs as well. Due to the amount of pollutants in the air causing asthma and other respiratory issues, we also want to focus on that and have them learn the value of that as we are running our program this year. So that's the reason why we have those two specific systems as our theme. As far as the way the program runs, we have various classrooms rented out. We're going to have medical students such as yourselves, teaching our students, and we have a program booklet that's being passed around, and that's all the information that's going to be taught to the children on that day. Again, focusing on the lungs, the heart, and also nutrition and healthy living in general. And there also will be a separate clinical medicine technique session taking place as well, looking at how to measure heart rate, blood pressure, and other things like that. As far as our program this year, some new things we're trying to implement. We're going to actually have high school students come in and help us. So we're instead of just reaching out to the elementary school kids, we're trying to incorporate other demographic high school students to kind of have them introduced into this as well, and have them actually help out with the teaching and with the running of the program. And so that gives them an opportunity to see that school as well and to help out. And then also, starting this year, one thing we really wanted to implement this year was a follow-up program. And so instead of just having the event and just saying, hey, see you later, come back next year, we're trying to follow up with them and either semi-annually or annually tell them about different programs that will help keep their children motivated to follow the career of medicine, whether it be a doctor or a nurse or whatever, so we can have that continuity after the program and continue to have them be exposed while they're at home or in their schools and with their families. And as far as our parent program this year, we have a program for them specifically. And that part of the program is basically focused on adult health issues and how to get their kids ready for medical school if they want to pursue that. And just in general, again, like the children's program, focusing on the health overall and overall wellness. And as far as our budget, as far as what we requested, most of the support will be going towards teaching supplies, and the reason why we asked for that is because, without the supplies, we can't teach the children. So it's very important that we have that available, so we can have a great program that that's running smoothly and is able to be successful. And also a portion of the support will also go towards giving T-shirts to the children, because we want them to have that experience and be able to wear it, kind of be proud of it. Like I was at medical school and I learned so much, and every time I look at it, I have that experience. I'll come back to it. So a portion will go to that as well, and then also some will go to the gift bags because we want to give them a variety of materials to take with them. Materials that we're using during the program, but also materials they can take with them when they go home. And they can have that with those memories as well. So trying to get that together. As far as besides that, as far as how many students we're having this year compared to last year, we've been able to recruit 100 more students. So we've had over 400 students sign up. Unfortunately, due to our limitations in budgeting, we had to turn down quite a bit of them, about 100 of them, just to make sure we are able to fulfill or able to serve the children that come here in an adequate way. So, just making sure we're being intentional and being, being thoughtful to the quality of the program. So we had to do that, unfortunately. But it's good because, we get to focus on the children that are here, and, our outreach in general this year has expanded to more high schools, so that's why we have more students. That's why we have more students apply and be a part of the program. So in the future, we'll try and find a way to accommodate more students. Whereas this year is our first year expanding this new amount of high schools, or this increasing amount of high schools. So we'll definitely improve on that next year.
And lastly, guys, I guess I just want to emphasize that this is the 25th year that this program has been in operation. And on average, over that time, you can say it's about 200 students per year, and that's like 5,000 kids. And as you just heard Selson say, and Selson Belton, and I'm Janelle Lee Allen, Vice President of BMA. But as you heard Selson say, the program is getting bigger. Parents are, saying, my kid did it last year, I want to do it again this year. So, parents like it, and the children like it. So, and each year we try to keep it fresh. But just again, knowing that this is the 25th year, we do anticipate more students from last year. A few more, since we did turn away some. And we really do anticipate the program going larger and larger. So this really does help to make it possible. Thanks again for your time.
Thank you guys. That was great. Just want to emphasize too, and agree with you guys. Reach Out to Youth is a phenomenal program. Student Senate has a long history of supporting you guys. With that said, just to be clear, what is the total that you guys are asking for?
We're asking for 1,000.
Okay. So since that is a sizable portion of the remaining allocations that we have this year for student organizations, forgive me if these questions are pointed. So last year, you guys came in, we supported you gladly. Some of the discussion that went on was sort of around, how to maximize the dollar amounts for this year. And part of that was you're saying that you were going to sort of secure a lot more longitudinal funding and more sponsors for this year, and the plan was not to have to ask for more this year from us. So I'm curious what your efforts were to secure sort of some of those bigger sponsors and more longitudinal funding to keep the program secure from year to year, because our funding allocations fluctuate too, and we hate to lose this program.
Well, I guess as far as improving the longitudinal support that we will receive in the future, the Black Medical Association is a larger, it's a small entity of a large organization, the Student National Medical Association, which does now have a 501c status, which basically means that they're a nonprofit that's able to take part in, be more robust and participating in nonprofit fundraising and being a part of more nonprofit organization or nonprofit functions. So in the future, we definitely want to rely more on them for funding. And as far as other sources, we also reach out to hospitals, previous donors from the past. As we were going on our fundraising campaign for the past couple of months, we reached out to those previous donors. Noticed some gave, some continued to give. others weren't able to give this year. And we noticed there were more not able to give this year for multiple reasons. So definitely appealing to them and continuing to, gently ask for support, but be understanding as well if they're not able to.
That's great. The other thing was, I remember from last year, there was kind of, I don't know, I mean, this is unavoidable to a certain degree, but the people that signed up for the event, there's always going to be a certain percentage that don't show up, and that sort of turns into wasted resources. So what efforts did you guys kind of implement this year to curb that and increase the number that attend that signed up?
I mean, just from, not just for DPS, essentially the program's focus was on Detroit educated children. So you can be from any school as long as you're in a Detroit based school. So we opened up to charter schools as well as other smaller schools. We went through calls, personal visits to different principals and vice principals, seeking out even people on the school board for DPS. So there were a lot of things that were done, including, again, just making sure that we had our database for all of our past presidents, making sure that we completely sent them out. The request saying, hey, now guys, it's time. So there was a lot that was done to make sure that we had increased enrollment.
Great. And then lastly, and I'll stop going, guys. What type of resources in particular were you guys able to turn over from last year and reuse to save having to purchase new ones this year?
I think, as far as resources that we have from last year to be able to utilize this year, we did have a portion of the funding from last year that we were able to help with Reach Out to Youth. And we did have some T-shirts as well. Not many T-shirts, we don't only a few to help out as well. And I believe we had some classroom materials left, but we don't have much of those. Most of those were used last year. So we have a few items, but we don't have too many to help supplement this year.
Well, if they were used, that's a good thing. Right?
Yeah,
right.
Supplement in the sense of taking care of a large portion. A lot of things did not go unused last year, and which is a good thing. A lot of our children did show up. So.
Well, commendable work. Really good job, guys. Are there any more questions?
DPP has been really pushing this relationship you might have with Whole Foods. Have you guys tried to contact them? Because
We didn't.
And were they willing to help with support or educators or?
I think we reached out to them really, really early. And so they told us that we really needed to reach out to them a little bit before the event. So I think that there are some calls going back and forth within the past, couple weeks so that we can kind of get a confirmation as to what it is that they'll be able to do for us. Because we reached out to them, we were trying to reach out, before school started so we can kind of hit people pretty hard when we had free time. So I think we're kind of still waiting to hear back.
I could just ask, because I got into this conversation on the sidebar, what happened with parking?
What happened with parking?
Because we can't put up the gate anymore, and somebody must have talked to Dr. Norman. Dr. Norman was asking, and the gate going up is $3,500 now, so we don't put up the gate. But what did you guys end up doing for parking for your parents?
Well, right now, I don't know that we got a word back to
The word
say
back is no.
to confirm. So then, are we saying that happened for this year? But
Yeah,
this year
is a
we're no
change.
longer.
Nobody is getting the gate put up because it's $3,500. When it was $500, Reach Out to Youth would ask for that
Yeah, we had
$500, which I usually paid out of this other alumni fund account. But this year it's $3,500, and I haven't been able to lift the gate for any organization that's asked. So and Dr. McLean knows this, every organization has to tell who's ever attending that they're either responsible for their own parking or you have to figure something out. So I'm sorry if you didn't get that message back, but there will be no gate lifted this year for parking. They make us pay for every single spot in the lot when we lift the gate. And I can't do anything about it, believe me, I've been over there, I've done my little temper tantrum, didn't work. And it's just not gonna happen. So I don't know what you're gonna do about that, but I know other organizations have had a similar problem, and I'm curious if they figured out how to address it or not.
Are you guys, is anyone aware?
Down around it.
There's no get around, but do you buy cards for your, I mean, like, what do? You know, you can buy individual day cards and then station somebody out at the parking lot, you know, where you feed the card in.
Well, you know what, I can actually write down, are you aware of the person who we contact about buying the individual cards?
Well, Ron Spalding knows where to buy the cards and he gets a better rate than if you were to call, let's just say that. And as I understand the parking, what?
Would they be $3.25 each? Would they be the lowest rate per week?
I don't know what it is, I can't remember what it is, but he knows the lowest rate that we can get. And as I understand it, you have to put a card in to get in and one to get out, but it's the same one, right? Right? So I was thinking, if you could position, if you know how many are coming, you can purchase the cards, and then you can station somebody at the gate, and you can, you know, work the gate for them, and then give them that card so they can get out.
Okay, well, thank you for
So
that.
anyway, that's, I
Finalized.
realized as you were talking, it came in late, but I didn't know if you ever got the word that, yeah, we're not looking at the
No,
gate.
I don't think we got that.
You know.
So,
And you got enough time yet.
So it's been.
Tiger's Lot, yeah, with the shuttle. Oh, I don't think we're gonna do that for this. But gotta love it. You're right, for the gay law, we couldn't do it.
Are there any more questions for these guys?
I'm not sure if you mentioned this or but what are your sources of funding, and does it include the main campus?
I think that's the sense of that.
Yes, well, actually, no, not for main campus. We tried applying for main campus, unfortunately, and we were denied. Unfortunately, the reason was because, or supposedly is because it wasn't targeting Wayne State students. They tried to say like, hey, we have Wayne State medical students, you know, teaching these kids, so it does involve Wayne State students, but I guess since the majority of those being involved are DPS students from elementary school, they didn't see that as a worthy cause to support. We have received funding from the Alumni Association, also from St. John's. Like I said, previous donors from the past, and also our e-board members have talked to their mentors about giving support as well. We got support from them. You know, I went to my church for support, and we had a fundraiser earlier in the year at at Oldest Kitchen. It gives a little bit of support as well. So those are some of the main sources of funding that we received this year.
Any other questions? All right. Well, thanks. Great job, guys. Contact you.